One more time looking up here. So we said that the radial groove is for the radial nerve to passes through. This bicipital groove is the groove between the two tubercles, greater tubercle and lesser tubercle, and through it passes the long head of the biceps muscle, biceps brachii muscle. Down here, we said this is a lateral epicondyle and medial epicondyle. The radial nerve passed through the radial groove. The ulnar nerve, which we'll talk about nerves later, as it goes down, it goes behind the medial epicondyle and comes forward like so. So it runs behind it. The median nerve, on the other hand, just goes right over. Okay, like so. So you have the radial nerve, the median nerve, and the ulnar nerve. You can feel the medial epicondyle on yourself. Okay, if you look at my arm, I'm holding my arm like so, and if I look down there, see that portion that sticks out right at the angle? That's my medial epicondyle. Sometimes you call it the funny bone, because when you hit it on something, when you hit that medial epicondyle on a table or something, you get a very tingling sensation, very unpleasant sensation, especially in your hands. This tingling sensation. That's because we said here that the ulnar nerve passes in that area. So when you hit a surface, you hurt the ulnar nerve, and that produces a tingling sensation, because the ulnar nerve, which we'll talk to later, will then go and innervate your hand. So that's why you get tingling sensation in your hand. The forearm consists of two bones. I made a quick sketch here, but it's not this short, it's actually a little longer. Anyways, here is your radius and here is your ulna, and we said that the ulna is more medial and radius is lateral. So if you look at my hand, the ulna is towards my thumb. The ulna is towards my pinky, and the radius is towards my thumb. Lateral, medial. Okay, so you can see here the head of the radius is going to be here, articulating with the humerus, with the capitulum of the humerus. But the ulna, on the other hand, is inverted, so that the radius head is here and base is here, ulna base is here, head is down here. So you can even see that structure. It's like the two are anti-parallel. And then, so we'll start with radius. We have a head, and the head is like very circum like shape, like so. Okay, like a disc actually. Okay, like so. And at the top we set a groove for capitulum. So capitulum goes here. And then you have a neck, and then a tuberosity here. It's kind of like rough, called radial, because it's a radius, radial tuberosity, site of attachment of the tendon of biceps brachii. Then you have this sharp border here and very flat here. Okay, like so. And you go down and you get in the base, and then this is called styloid process of the radius. Holding the radius and the ulna is the interosseous membrane. We'll talk about membranes and ligaments later, holding these two together. Okay, so then we're looking at the ulna, the base here. We set it W shaped like this to fit into, for trochlea to fit into it. Then you have this here called the radial notch of ulna. It's the radial notch of ulna, and that is where this head of the radius fits. And that is one example, another example of the pivot joint. One pivot joint with the dens with the atlas, the atlantoaxial joint. This is another one, because this radius, like if this is my pen is the radius, it rotates like that. Okay, and that, so you can imagine this is just rotating this way and this way, and that inside that groove, so like this.